So here at Emerald Dental Surgery Clinic, we will be speaking with Dr. Alan Ochanji, who is a dentist and who also will be taking us through some of the ways to prevent yourself from getting some of these teeth or mouth-related conditions such as gum disease, gum cavities, and so forth. We will be looking or having a demonstration on how to properly brush your teeth for both adult and also kids. Will also be having a look or demonstrating for you mouth washing practices, how many times are you supposed to have it, and also scaling, which is a process that every person should go and check or see their dentist to just ensure they don't have some of these conditions. That is what we are here to do, so just stay tuned and follow me. Hello.
Hi.
Hi, I'm Purity from Ebri TV. We are here for the My Doctor Show program. I don't know whether you could guide us in getting Dr. Alan Ochanji.
Okay.
Yeah. All right. Hello, Doc.
Hello, how are you?
I'm okay.
Welcome to Emerald.
Thank you so much for allowing us come to your clinic today.
You're welcome.
Yeah, and as we had earlier on, I told you that today we want to talk about oral hygiene. That's why we are here today, to just have a look at some ways of preventing ourselves from getting these oral related conditions. And maybe before we get to what we came here to do today, you could just take us through some of or what really, when you talk about oral hygiene, what does it mean?
Thank you, Purity. Oral hygiene is very important. The mouth has several structures, and anything affecting any of the structure can present in terms of a pathology.
Right.
And when you talk about the oral cavity, we have the teeth there, we have the gum, we have the tongue, we have soft tissues, and then the mouth communicates with the rest of the body. So the rest of the GIT is connected to the mouth. You also have the sinuses and the nasal cavity and the rest. So we have any problem affecting the mouth, it will eventually affect other parts.
Right.
And so it's very important to have good oral hygiene. And when I talk about good oral hygiene, I mean a case where you don't have cavities, you don't have bad breath, you don't have discoloration, you don't have cases where dehydration affects your tongue, and all those kind of things. And so when you come in a facility like this, most importantly, we emphasize on the techniques you need to use to do brushing. Because if you brush well, chances are you'll not have so much of a problem. Then once you've done correct brushing, you're supposed to come for regular checkups. We advise that at least once in a year, the best will be twice in a year. You come, we check if there's a problem, we advise you in good time. The other thing that you need to do, apart from good brushing, you need to change your toothbrush every so often. Then when you talk about bad breath, there are other causes that are not really related to the mouth. If you have problems in your the rest of the gastrointestinal system, it could present as bad breath. If you are dehydrated, for example, it could also present as bad breath.
Right.
In cases where there are also psychological environment where you think you have bad breath, but actually you don't. So all those, you come in a setup like this, we assess, we advise you, and then give you the way forward. So probably the basic thing and most important thing that I can demonstrate here, it's how to brush. And I'll introduce you to my patient. I'll show her how to brush.
Right.
A simple way, because if you brush right, 90% chances that you have a good oral hygiene.
Right.
And then that, most importantly, it will prevent you from getting, because the treatment part of it comes once you already have the problem.
Right.
So,
and just before we get to the brushing, Doc, maybe you could just list to our viewers some of the techniques that we are looking forward to have them demonstrated right here at the clinic.
one is the correct brushing technique. On and off, we normally advise you to use mouthwash, not continuously, because if you continuously use the mouthwash, it kills the normal flora in the mouth. So you use it intermittently over a given period of time, and then you stop. We also have a dental floss that goes in between the teeth. I don't have an interdental toothbrush, which is also very important. It goes in between the spaces of the tooth, so it removes the debris that will stay there. And with the normal brushing, the areas you can't reach. So the floss plus the interdental toothbrush will go into those areas. So we'll show you again, once you have a problem, what you need to do. I'll demonstrate how we do scaling under the chair.
Right.
We also do polishing. And then other than scaling and polishing, if you have a cavity, you need it filled.
Okay.
If you have malalignment that is making it hard for you to get a proper cleaning, you also have to get them aligned. So any problem that will contribute to an area of stasis where food will go in will eventually contribute to bad breath, will eventually contribute to poor oral hygiene.
Right. Maybe we can start with correct, like you call it, correct brushing, right?
Sure. So what we'll do, kindly come with me. This is a toothbrush,
Right.
and a soft one for that matter. There are a number of them in the market. So this is just one of the many. This is for Colgate,
Right.
but you have a number of them. And if you can see, the bristles is completely different from the rest. It's soft. Whatever we're removing in the mouth is not hard. So it does not benefit anyone to brush with a lot of force. The technique is how you use it,
Right.
frequency, and with what material. And then with me are two common products in the market. This is Sensodyne, this is Colgate.
Right.
These are just toothpaste that anyone can use depending on your preference.
Right.
And then, so normally what happens is you use this to reach every surface of the tooth.
Right.
So you just come with me, hold this. You'll choose one of them, whichever you want, and then you load your toothbrush. So normally what happens is,
What's the size? Can you just put any, what amount of toothpaste are you supposed to use, or just any? You know, some other people use a lot of toothpaste, others use just little. Is that recommended?
We're not specific on the amount you're supposed to use, but what will guide you on the size of the bristles.
Okay.
So something going 3/4 to full amount is good enough to cover the surface.
Right.
Then you can see she's done that. So we just come to the sink here. It's okay. So what I want you to do is to make sure that you clean every tooth surface. So the tooth has like 3 surfaces, if you can say. There's the outside part, there's the on top, and then there's the inside.
Right.
So when you're brushing, you make sure you clean on the outside, you clean on the top, and then you clean on the inside. When you're cleaning, you don't choose a lot of force. For efficiency, you can decide to group the teeth into maybe a group of 4 or 3. So when you're starting from here, you can put a group of 4, brush them, dedicate a number of strokes. Let's say when you're starting here, maybe you dedicate 10 strokes. So you do 10 here, you do 10 on top, you do 10 on the inside. Once you've done that, you move to the front teeth, the ones that we call anterior teeth. Then you do the same to the other side. You do whatever you've done on the lower side, on the upper side.
Right.
Maybe you can just try on one segment, not the whole mouth, just so that we get to know the exact thing we need to do.
And should she maybe mix it with water, or take some water first?
Just for greasing, maybe when you're starting, you can just put it in water or put a little bit of water on top of it,
Right.
to make sure that it's soft and also the greasing is okay.
Right.
Then you can, there's no preference where you can start. You can do it any segment. So in this case, you've chosen to start on the 4th quadrant, the one you say. So in my model, I would expect you to brush on the outside, which you're doing very well. Dedicate a number of strokes on the outside. In this case, we're choosing 10. Okay. Then you go on top. Before you move on to the next, make sure you focus on that side.
Okay.
So we are on the second surface, that's top surface. Dedicate a given number. Good enough. Then now let's move to the inside, on the same segment but the inside. So you see, she has done the outside,
Right.
she's done the on top, she's now doing the inside.
Right.
Okay. Then once we're done with that, now let's move to the front segment. So you see, the angulation of the brush will now change. So whatever you are using posteriorly is not the way you're going to use it here. So in front, we'll just expect you to brush on the outside, the way you're doing. And then on the inside. The inside sometimes, so that you reach the teeth, you can put it like that, but on the bristle. So you do back and forth like I'm doing, to make sure it goes to every tooth surface.
Right.
You dedicate a given number of strokes as well. Okay. The trick is in the technique, is not the force or how much you use. So you do that to all the teeth surface. You could extend to the other quadrant and then do outside. on top and the inside.
Okay.
When you're done with that, you just rinse
Yeah.
with water. Like in this case, there's water there. You rinse, and then you make sure after rinsing, you clean your toothbrush as well.
Yeah.
And then there's a technique of also.
So she'll pour.
You just rinse here.
Rinse here,
then
okay.
pour here. And then clean again, just to make sure that all the traces of toothpaste is eliminated.
Is it
'Cause
okay,
again,
Doc? First, how many minutes should you dedicate for brushing? Because some people go it for like 2 minutes, you're done, and the way you explaining, you have to, you know, have a section of brushing your teeth. It's like it can take even up to 10 minutes, but many people really take even 2 minutes, 3 minutes.
Actually, 2 minutes is a lot. Most people
Yeah.
take under 1 minute.
Is it
Actually,
okay?
then they're late for work. Anything between 3 and 5 minutes will give you an adequate time. And that's why we advise that you brush in the morning after breakfast, but most importantly, before you go to bed. Because that's the time you've just eaten, you have ample time, and also the rate of saliva flow reduces when you go to bed. So just before you go to bed, make sure you brush very well every tooth surface.
You're recommending twice in a day, right?
Twice in a day is good enough. If you can do 3, the third one you do in the office, well and good. As we would advise that, make sure you do it well and good in the morning, after breakfast preferably. People find it hard sometimes to brush before or after breakfast, whichever is preferable for you, but we advise that you do it after breakfast.
Right.
Then just before you go to bed.
And just before we get to the next step, why is it important to have, you know, a routine, a correct brushing routine, as you call it?
Because brushing is the most important aspect. If you don't brush adequately, eventually you have food materials lodging in between the tooth and the gum. Because between the tooth and the gum, there's usually a crevice, a space. So that's where food goes in. If you don't brush adequately, food will stay there. And the first symptom will be bleeding of the gum, then eventually you'll have bad breath.
All right.
So to eliminate that, you must get it right with brushing.
All right.
80% of the problems in the mouth, you will sort it out with brushing. Then now the extra 20% we can look for where the problem is and sort it out.
Right.
Then just before we conclude, we also have other aspect. As I told you, this is a floss. A floss is just a string. So what happens is, you just cut a piece.
And maybe that would be all for correct brushing. I think other questions
Exactly,
will come
exactly.
from our viewers.
You
Now we are
just-
moving into flossing, right?
Yes.
Maybe you could tell us what it is first and how to go about it.
Flossing is just, in a layman's term, is just a string, but in this case is enriched with some fluoride to protect your teeth. So the idea is to make sure that whichever place you can't reach with a normal toothbrush, you can reach with the floss.
Okay.
So you just take a piece and roll it in your fingers, then you pass it back and forth in between your teeth.
Yes.
So probably you could also have a try X and just try if you can reach. Mine are doing the model. Sorry, my
How
model
many
is
times
not.
are you supposed to do on a daily basis, or?
This is something that you need to do on a daily basis. Probably the most important time is just before you go to bed. Again, because you have ample time. You just take it in between your teeth. Okay, you roll it long enough. Just fold it again so that you have adequate length, and then just pass it in between the teeth. Just open wide, open your mouth. Yeah. You do it on one side. Yeah, like I'm trying to do mine.
And should you
Back
exert
and
so
forth,
much pressure? Because I think
you
it
don't
can
need
also
to. You don't need to put a lot of pressure, because again, if you use a lot of pressure,
you
you're going to
experience
hurt
some
your
bleeding.
gingiva,
Yeah.
and then you'll cause bleeding. So instead of getting the beneficial aspect, you'll be gaining the more pathology.
Okay.
The other thing is, apart from the floss, I'd say there's an interdental toothbrush that actually goes in between your teeth. So when you do that, you clean them off.
Okay. And Doc, what could be or what should be used for flossing? Because most of the people do not have what we are having here today. Others use just the normal, you know, do we call them?
Others use toothpick.
Toothpick.
Go in between the teeth. The most recommended is either dental floss, because they're designed for that, or an interdental toothbrush.
Okay.
Because they are small brushes designed for the spaces in between the teeth, and they clean very well. The advantage with those is that you don't get injuries. Toothpick you can use, yes, but they'll end up in injury. Then the floss itself is enriched, sometimes with fluoride, so it has beneficial aspects. That's why we advise on flossing. we advise on using interdental toothbrushes.
Right.
Yeah.
Okay.
And then
thank you.
the last thing is you also need a mouthwash
Right.
from time to time. This is Remedin, but there's so many others. This is chlorhexidine, but there's so much in the market which you can use.
Again,
So
why is it important to have some mouthwash maybe once in a while?
Once in a while, it's important because this mouthwash has antibacterial activities.
Right.
And then it also has what we call anti-plaque activity. In other words, it prevents food materials from attaching onto the tooth surface. So when you use it, you get the benefit of not having tooth materials attaching onto your tooth surface. And also, it has antibacterial activities. So bacteria that will cause gingival inflammation and cause bad breath, you get them acted upon by this particular mouthwash.
Right.
So this one you just get a bit, not a lot. You just put it in. That will be enough. You get a tumbler, put it there, and put it in the mouth. Then you make sure it stays in the mouth for a minute or so before you spit. And then you don't rinse immediately. You wait for maybe up to 10 minutes for it to get into all the areas, then you can rinse.
Okay. She can use
So
some?
this one, yeah, you can give it some to use. So that you get this one you had already used, so we clear it off, put it there for you. Then you can use that to rinse.
So what's the procedure? She'll take it, then she'll have to gargle.
You gargle it,
Yeah.
like in my case, put it like this, up, and gargle. Yeah. For a minute or so. Okay. In this case, maybe not a minute. Then you spit, not a lot.
Yeah.
After that, you don't rinse immediately. You give it up to about 10 minutes for it to sink completely into the crevices. Then after that, you just rinse with the normal water. So that's a routine that you need to do probably over an extended period, maybe 2 weeks, then you stop. Because as I said, again, if you overuse it continuously, it has problems.
Okay.
That comes with it.
Well said.
So probably the only other thing I can show you
brushing,
is
flossing and mouth
so
washing.
we are assuming that when you do all that, there will be no problem. But should there be a problem? Now that's where we come in terms of doing actual procedure.
Right.
So probably what I can show you here is should you be having the problem, you're having bleeding gums, you're having cavities, you're having bad breath, what do you need to do? You need to do all this I've explained, but on top of that, you need a professional help. Like in this case, most importantly, we do what is called scaling and polishing, where we remove all the debris and all the tartar, they're called calculus, that get attached onto the tooth surface. So probably that's what I'll demonstrate shortly. Just come back.
So I can see now we're getting to scaling, which is one of the ways of treating gum diseases, right? If I'm right, Doc, maybe you can just explain to us what about it and maybe demonstrate to us how to go about it.
You're right. Scaling is very important. We do it in cases where you already have a problem. And the problem is, between the tooth and the gum, there's usually a space. Over a period of time, food particles accumulate in those spaces. And then with that, you get bleeding gums, you get swelling, you get bad breath and all that. So suppose you have that problem. You come to our clinic, we assess, and then we see. So it's simple. What happens is, we check into the mouth. My patient is okay, she's comfortable, you've explained everything to her, and she's easy. So all we do is just to check where the problem could be, and then if need be, do the treatment. So in this case, I'm examining her. I'm looking at the number of teeth she's having. You can see generally she has good oral health. So in a case where my patient comes with complaints, I first assess and see the whole mouth where the problem could be. So I'll assess if there is any cavity. I'll assess if there is bleeding gums by just running my probe gently. I'll see if there is any tooth that is overlapping the other. I'll check, just put your teeth together. I'll check the arrangement of the teeth. Open again. I'll check the tongue surface, if it's clean, if it's okay. All right. Then I'll make more emphasis on the space between the tooth and the gum, because that's where food particles goes in. and then the spaces in between. So this is the area of interest. All right, like here. Just put your teeth together. These are the areas of interest.
There's some bleeding there?
Yes. What happens is if the gum is inflamed, sometimes when you touch this easy bleeding. So all that we do in scaling and polishing is just getting an instrument that can easily go into those spaces and do some cleaning. And then after that, so this is what we're going to do shortly. So my instrument releases water. So all I do is to open. So all I do is to target those spaces, like there, run my instrument which is releasing water into those spaces.
Doctor said that's what? That's scaling?
This is scaling.
Okay.
This my instrument is called scaler. So all it does is it vibrates. As it vibrates, it releases water that goes in between those surfaces.
Again,
so
it's
do it there. So you do that to all the surfaces. Remove all the debris, remove all the calculus, we call them so. That will be on the tooth surface, and that will be preventing in terms of bleeding and bad breath. Now, this is something that you do for the whole mouth, every tooth surface. You make sure your patient is comfortable and there is no pain when you do it on all the tooth surfaces. Once you're done on the outside, you also come on the inside and do the same.
Okay.
So what I'm going to do next is just polishing on that surface we had worked on. And then normally what we advise is once you've done the scaling, sometimes we give the patient time off just to go for the gum to have some healing, then you come back for polishing. That makes sure that you're doing the polishing when there's no bleeding and when the gum is okay.
Right.
So in this case I just rinse again. Just rinse to make sure everything is clean. Now the tooth surface. As you can see fresh areas where we removed all those debris and they're now clean. So all we do is to put up a paste.
What's that?
This is called trophy paste. It has a topical fluoride in it. It has some abrasive pumice for cleaning off all debris, and most importantly it has fluoride that has anti-caries activities. So what you do is just to rub it gently on the tooth surface, and once I step on it, it vibrates, so I just clean off like that, like so, like that. Like that. I do the same on the inside. Where I just smear it on the tooth surface. Make sure you put enough amount and then just clean it. So all I can say is this is a professional way of doing toothbrushing. So whatever I was explaining is for you to do at home. Whatever I'm explaining is what we do under the chair.
And again, for polishing is also once in a year, right?
Normally it's done together with the scaling. Actually, if you come regularly, it's the polishing that we will be doing every time you come. We only do scaling where you have calculus on your tooth surface.
Okay.
So once that is done, we just rinse gently with the water.
So this one is for taking the dirt and the water to...
So this is just suction tip.
Okay.
Just remove all the water, all the saliva, all the debris into a system. So that is that for the front teeth. As you can see, the teeth are clean. Fresh areas where the debris and they've removed, including the inside as well. This is something that we need to do for the whole mouth. We've just done the front teeth, but we also do it for the others. So the advantage of that is that it removes all the debris on the tooth surface.
Right.
And then it leaves the patient with a fresh surface that is easy to clean.
Right.
Normally, after the cleaning, sometimes some people get sensitivity. So all we do is we advise them on what to do after that and remedies to use in case they get sensitivity. Overall, it's a very simple process. It's easy and it's very important that people should do at least once in a year. It helps you take care of good teeth.
Right.
And also make sure that you don't end up in a problem that people encounter in the mouth.
All right.
Apart from that, there are a number of things that you need to do. If there's cavity, you need to have it filled. If there's a tooth that is buried in the bone or is partially erupted, you need to get it out. If you have any pathology anywhere, you need to take it out. The other thing that I didn't talk about is when you're brushing, also spare time and brush the surface of your tongue, because it also harbors a lot of food debris and it needs to be cleaned.
Okay.
So the tongue surface, every tooth surface, everywhere in the mouth, clean it, and it helps us because, as I said, apart from being the organ you use for eating, it also connects you to the rest of the body. So you have the rest of the GIT, you have nasal cavity, you have the sinuses. So you need to have it as clean as possible.
And so that would be all for this segment of My Doctor Show. But to receive your calls, to also respond to some of your questions in studio, we will be having Dr. Alan Ochanji use the SMS line, which is free of charge, 20268. You can also call us live through the number that will be displayed right at the bottom of your screen. On Twitter, we are at Ebu TV Kenya. And yes, we will be talking more on oral hygiene. So see you in studio.